What's good, YouTube? It's your man CJ Kyles checking in once again, back with another video, aka the High Value Nurse, here in these YouTube streets. And I want to have a conversation with y'all. You gotta put yourself first.
You can live pretty well by yourself.
Listen, ladies and gentlemen, recently somebody sent me this article of a nurse, an ER nurse, who actually deleted themselves. Now, I'm not going to read the article. I'm just going to kind of give you the cliff notes, but you can find it out there. It's out there. So pretty much the article goes into talking about how the young man had ended up bringing a weapon to work, and halfway through the middle of his shift, he ended up deleting himself. And as a matter of fact, let me go to the article. I'm gonna go to a little bit of the article. I'm gonna read a little bit of it, but I'm not gonna read the whole thing. But he ended up deleting himself, and apparently this is starting to become a thing, because I remember last year I reported it on a young woman in the UK who actually deleted herself because the stresses of the job was just too much. So this article comes from World Socialist website. This is one of the only websites I can find that didn't make me sign up. So it says a nurse at Kaiser Santa Clara Medical Center died by suicide this week while working in the ER. Sources told NBC Bay Area that the nurse brought a weapon to work and Wednesday night deleted himself halfway through the shift. Now, the person has not been named yet, but the co-workers confirmed that it was a deletion, a self-deletion, and it took place in a supply room right in front of another co-worker. So, man, that's how tragic is that? Because somebody else even had to witness that, and now their life has changed forever. You know what I'm saying? And I understand that over there in the Bay Area that they are having a nurses strike as well. So you have a lot of nurses. They are over there fighting for wages. They're fighting for safer working environments. They're fighting for mental health services. And, you know, nurses are, again, they're burnt out. They're tired. They don't, you know, and it's pushing them to this point. Now, let me say this. Well, let me read you this quote. One of the nurses who works at Kaiser said that they are notoriously bad with their mental health services. So this is obviously not a good look for them, but nothing will change. Nurses are burnt out, and COVID has highlighted undervalued labor, and you're just a number to the hospital. Now, this is what she's saying. I've never worked for Kaiser. I don't know what their system is like, but this is what she's saying. This is what this nurse is saying according to the article. It's a high rate of burnout. And one of the most interesting things that I found within this article, it says even before the pandemic, there was, let me not misquote, but before the pandemic, there was even a higher rate of self-deletion among nurses. Before the pandemic, let me see. All right, here it is. Even before the pandemic hit, a 2019 report done by Judy Davison, a UC San Diego nursing and psychiatric researcher, found that nurse deletions were 41% higher for males and nearly 58% higher for female nurses as compared to the general population. So nurses are at a very much increased risk of self-deletion due to the stresses of the job. And there was another nurse named Mr. Michael Odell, who also back in January committed deletion in the middle of his shift. And he already had he attempted to do it in April, and I guess he got some help, or attempted to get some help, and later on January 2022. Well, he had planned to start travel nursing again, but he ended up taking his own life. And they found him in the river, the San Diego River. So my heart goes out for these people. My heart goes out for these healthcare workers. My heart goes out for my brothers and sisters in nursing. And I feel a couple different ways about this, because then the article goes on, talking about how Biden is pushing all this funding and all the funds for the Ukraine, and not looking out for the healthcare workers here and everything like that. Now, that's a whole nother topic, and I do feel a way about that, and I do have an opinion on that, but I'm not going to get into it in this video. This video is more so about the nurses taking their own self-care into their own hands, because like it or not, at the end of the day, this is a business. It's a business. You have to go into it knowing that it's a business. And just like the article, I don't remember if I read the part, but just like the article stated, that he will be replaced before his body even hits the ground. That's just how business works. It's a cold game, but it's a game nonetheless. Now, whether you choose to play this game, that's up to you. Also, I want to remind y'all that there are so many other things to do besides patient care. Let me tell you something right now. If it ever gets to the point to where it's too much, I'm gone. I'm going to do something else within this field. I am not putting my mental health at jeopardy for a job, for a business that will replace me. That is why it's so hard. That is honestly why it has been so hard for me to grasp being a full-time staff employee, to have a commitment, a long-term commitment to a job, to where I know that if something happened, I'll just be replaced. So that is why I'm continuing. And honestly, this article has really inspired more of my entrepreneurial side, because sometimes you really have to look back and appreciate some of the things you have already done and accomplished. And not to take away from the impact, the tragedy of what happened, because my hearts do go out for those individuals and their families, because that is a very sad situation. But we just have to understand when it is time to put ourselves first. I think as nurses, we are constant givers. Literally, it is our job to put our needs last, to make sure that the other person is okay. And I understand that it is a field that we chose to go into. But once again, I'm going to say it, and I'm going to say it again. There's just too many options, and I just feel like if it's that bad, why don't people step away? Is it because of comfort? Is it because of, the pay? Because money can be a great motivator. And maybe some people cannot take an insurance job, or a job that has nothing to do with patient care, or when you're not interacting with patients, because of the pay, because of a lifestyle that they built for themselves. Who knows? It could be one of many factors. But my point is, there are so many other things to do within this field. Like, real talk. So many other things you can do. And if you don't put yourself first, bruh, things like this happen. You need to make sure you are in the best form of yourself, mentally, emotionally, physically, all that stuff. And I think a lot of people truly sleep on how important those things are. This is why it should be absolutely mandatory that every 30 days, nurses are required to take a week off. That should be mandatory, number one. Number two, I already pushed taking a vacation once a month, but now I'm going to double down on it now. I'm really going hard with it now, because I really had to sit back and look, and not to go away from what we're talking about, but I really, like yesterday, I had a day off. I really had to sit back. Like, I was sitting in my crib, and I was really looking back and taking a look at what I built so far. And I just had to say to myself, wow, you are doing pretty well for yourself. And I took a moment to pat myself on the back, because I am leveling up, I am grinding, and I'm doing it on my own terms. I live in a wonderful area. I don't have to worry about, crime can happen anywhere, but I don't worry about, the things that people in worse areas may worry about. I can travel whenever I want to go at will, and I don't have to answer to nobody. I can do whatever. Like, I'm literally in the prime of my life right now. You dig what I'm saying? And what I'm building right now, it just, like, I got all the opportunity in the world. Like, I was really stressing myself out because, with my school situation in August 2023, I got accepted to the program, but I will have to wait if I don't get bumped up. And I was really stressing myself out. Not stressing, I wasn't stressing, but it was just something that was really on my mind for a long time, because I'm like, I want to hurry up and get it done. But see, this is what happens. But see, that's what happens when you start to interact with people who are not in the same situation as you. Like, my situation is very unique from a lot of the people that I work with. I don't have children. I can make six figures when I want to, and it's just, I'm not in that situation. So it's just like, I was really trying to rush because I was influenced by everybody else. I'm good. I'm in the program. My program is 8 months. It's free. Now, I know a lot of y'all say that, go ahead and get it done. No. Because it's not about y'all, respectfully. It's about me. And during those 14 months, I can focus on the things that I really do love to do, like seeing the world, like filming it, like traveling to different places, like doing my podcast, like focusing on my other passion projects, because that's what I love to do. That's what brings me joy. Now, I had to put in the work to get where I am right now and lay the foundation for me to even get to that point. But the point is, you still have to do what you love at the end of the day, because when this camera shut off, when y'all go back to y'all regular life and y'all log out of YouTube and I go back to my life and log out of YouTube, then I have to look at me every day and ask myself, am I truly happy with the things that are going on in my life? Not for YouTube, not for whoever, but for me. Is CJ happy? Because guess what? CJ got to put his size 12-foot shoe in these shoes every day and go to work. It's my time that I'm sacrificing, nobody else's. This is my kingdom that I'm building. And y'all have to say that about yourselves too. Are you doing it for you, or are you doing it to portray a certain image? Now, don't get me wrong, I enjoy what I do. I enjoy what I do, and I'm gonna keep climbing up the ladder in my career. But as of now, I'm focusing on doing things that I love. You know what I'm saying? I got some time to chill. I got some time to do what I want to do. And like I said, I don't know if I can ever go back to being on somebody's schedule like that. That's real talk. I don't know if I can ever go back. These next 14 months, I may just focus on my side hustles and grinding that out, because that's really what I love to do, and work from here. Like, listen, I'm going to keep it real. If I wanted to just stay where I am right now for the next 5 years and really focus on what brings me joy, I could do that with no problem. But no, it wouldn't be a problem. But I'm progressing because I want to, not because people think that I should. You know what I'm saying? And I do know that things get a little bit easier once you have those RN letters behind your name. But as of now, I'm not rushing nothing, because I really don't want to. I was doing it for everybody else. And shout out to Teddy G, man, who really taught some sense into me, man. I'm just like, why would I drop $20,000 when I can go to school for free? That $20,000 can go into my business. That $20,000 could go into more vacations. That $20,000 could go into investing. It can go into a lot of stuff. And it makes absolutely no sense for me to drive past the school that I could have went to for free, and past the school coming back home that I could have went to for free, to drive an hour and 10 minutes to a school that I'm paying 20 bands for. That is absolutely ridiculous when I thought about it. When I thought about it from my situation, again, everybody's situation is different. I don't have no kids. I don't have, no major responsibilities. I can make money when I want to. I'm cool. So the point is, do what you want to do for you. Do what you want to do because it brings you joy. Take care of your mental health, because like I said, bro, trying to please everybody will drive you nuts. It'll drive you nuts, bro. You gotta please you at the end of the day. Real talk. And if people just can't deal with that, then it is what it is. So ladies and gentlemen, that has been today's video. Please put yourself first. If you need help, go seek help. And just know them jobs gonna be there. Keep your license in good standing. They gonna be there. They ain't going nowhere. This whole undying loyalty to companies and they don't have it to you, that's ridiculous, bro. And that is honestly why I feel like I may never be able to be on a full-time schedule staff member ever again. So today's video, let me know what y'all think in the comments. Until next time, I'll holla at y'all. Peace.